Have you been having recurrent miscarriage and your doctor is saying that a procedure will be performed known as cervical sacrilege and you don't know what it actually means? This video is for you. Join me from the beginning to the end of this video to learn all you should know about cervical sacrilege. Cervical sacrilege is a surgical procedure used to reinforce the cervix during pregnancy. This is typically to prevent premature birth or miscarriage. So, what is actually this cervical sacrilege? Cervical sacrilege involves stitching or placing a band around the cervix to prevent miscarriage and to prevent it from opening prematurely. If you're a woman and you have incompetent cervix, this procedure is the procedure used to tie the mouth of that cervix to ensure you carry your pregnancy to term. It is usually performed between the week of 12 and the 24 weeks of pregnancy. Although this timing of this can depend in individual circumstances. So doctors, why are doctors performing this cervical sacrilege? If you have had history of premature birth or second trimester pregnancy miscarriage, this procedure can be performed for you to carry your pregnancy to term. If you have cervical insufficiency, that is incompetent cervix, where the cervix dilates or it fades too early in the pregnancy. So if you have short cervix and is detected on ultrasound, this procedure can be done in order to save your baby and allow you to carry the pregnancy to term. So there are types of cervical sacrilege. The first one is transvaginal sacrilege. So this one is placed through the vagina, where they open up the body through the vagina, then and is tied around the cervix. That is, they use something to tie the mouth of the cervix. So this is the common type that is being done in the hospital. But there is another one known as transabdominal sacrilege. This one is placed through your abdomen. They will open up the stomach and place it through the abdomen. In reverse for cases where there is transvaginal sacrilege is not visible or has failed in the past. If they have done the first one before and it didn't work, this is another method that they will use to tie the cervix inside to help you. Then the next one is, how is this procedure performed? You'll be asking yourself, is this procedure painful? How will they perform this procedure on me? This is usually performed either regional or general anesthesia. They will give you general anesthesia, that is, in the essence, you will sleep off, or they will give you half body anesthesia. So it is performed in theater. The service is visualized through the vagina via a laparoscopic instrument or transabdominal, or if it's a transabdominal sacrilege they want to they will go through the abdomen. So sutures or band, they will use suture to tie the mouth of the cervix to keep it closed. And what are the risks and complications that can arise from this procedure? The first one is infection. You might have an infection, you might experience bleeding, you might experience premature rupture of membrane or cervical tear if the woman goes into labor without them removing it on time, then preterm labor. So after this procedure, what are you expected to do? So after this procedure, patients are typically advised to take it easy and avoid strenuous exercise. Your doctor will advise you not to stress yourself, and regular prenatal checkup are essential to monitor the cervix length and the overall pregnancy health. As this thing has been done, you not just go home. You will be coming to your prenatal visit. Once you come, they will send you to scan to monitor the cervix to ensure it's not opening, it's not shortened, and the rest of them. So, how effective is this procedure to prevent you from having miscarriage? Cervical sacrilege has been shown to reduce the risk of this preterm birth in women with cervical insufficiency or previous preterm delivery. So this procedure is very effective and it is okay. They have done it to many women and have seen that it is okay in preventing miscarriage. So the success rates vary from one individual to the other, and also the timing of the procedure is very important. If you do the cervical circulation early, it can help you to hold the pregnancy. If you do it late in the pregnancy, is under probability. Then, what are the challenges that women face after this procedure? What are the challenges you are likely to face? So, this sacrilege placement can sometimes be challenging, especially in case of your in anatomical variation, that is the body variation or scar tissue from previous procedure. So if it can make you to have scar tissues, and scar tissues in the reproductive tract can sometimes hinder you from getting pregnant, or complication might arise unnecessarily in the later time of the pregnancy. It can lead to cervical tear and the rest of them. So how is this important to you? It's important that every pregnant woman knows about this procedure. It's very, very important to know about this procedure, especially if you have cervical insufficiency. It is important for you to know, have in-depth knowledge on what is going on, the purpose of the doctor doing this procedure to you. So it's very important. So if you like today's video, comment on today's video, like, share today's video, and see you in my next video. Thank you.